Bismillahirrahmanirrahim. Assalamu alaikum and hi my friends. As we have started the series of eye, and today our topic is eyelids and its inflammatory disorders. Okay? So before discussing each inflammatory condition of the eyelid, we should have the basic knowledge of the structure and anatomy of the eyelid. So let's go to understand the anatomy of the eyelid. This is the front view of the eye. Okay, this is the front view of the eye. And this is the side coronal section. For example, if I take my eye like this and I take the coronal section of the eyelid like this, so this is that section which I have zoomed. Okay, so the eyelid is mainly consists of two lamella, the anterior lamella and posterior lamella. These both lamellae, they are divided by a surgical plane. Okay, so the interior lamella is further consists of four layers. They are, for example, the first one is the skin, and this is the thinnest skin in the body. The second structure is the subcutaneous tissue. Below the skin is the subcutaneous tissue, and which doesn't contain any fats. The third layer of the interior lamella is the palpebral part of the orbicularis muscle. Okay, the orbicularis muscle which has surrounded our eye. So this is that palpebral part of the orbicularis muscle. And the fourth structure in the interior lamella is the submuscular connective tissue. Below the muscular layer is the connective tissue which contains nerves, blood vessel, etc. So this is the interior lamella. The posterior lamella consists of, the first structure is the fibrous structure. The fibrous structure in the mid, this is the eyelid, okay, and this is the midline of the eyelid. In the midline, this fibrous structure of the posterior lamella, it has thickened, which is called the tarsal plate. And in the peripheral region, this is the fibrous thin structure. But in this, centrally in the midline, it has been thickened. So that, and this is called the tarsal plate or tarsus. And this tarsus or tarsal plate contain mammalian gland. Okay. Now the next structure is the aponeurosis of the levator muscle. This is the levator muscle, and this is the fleshy part which is in the orbit. Okay, this fleshy part is in the orbit, but the aponeurosis comes into the eyelid and form the component of the posterior lamella. And the next muscle is the molar muscle. This is muscle. This originates from the under surface of this levator muscle and inserted on the upper border of the tarsus. Okay, and other we have small glands which are these are the glands of Cross, and these are the glands of Wolfram. These are the accessory lacrimal glands. So these were the component of the interior and posterior lamellae. The last structure in the posterior lamella is this is the, if this is the eyelid, and if I invert the eyelid, so the conjunctival part is covered by the membranous layer of the conjunctiva. So this is the membranous layer of the conjunctiva. This is also the part of the posterior lamella. But also there are some other structure in the interior lamella. We have the lash, the eyelashes, okay, the lash follicle, and this lash follicle has its associated gland which is called as gland of Zeiss and gland of Mohl. Okay, so this is the gland of Zeiss, this is the gland of Mohl. And in the posterior lamella, we also have the opening in the eyelid. So if I invert, if this is my eyelid, okay, and if I invert the eyelid, so there will be the opening of the meibomian gland. So this is the opening of the meibomian gland. So this was about the structure anatomy of the eyelid. The arterial supply of the eyelid is from the ophthalmic artery and lacrimal artery. They supply the eyelid. The lymphatic drainage is the eyelid drains into the pre-auricular lymph nodes and into the submandibular lymph nodes. Okay, and the nerve supply is that the sensory supply is from, we know that trigeminal nerve. Okay, and the motor supply is this levator muscle is supplied by oculomotor nerve number cranial nerve third, and this is the molar muscle. The molar muscle is supplied by sympathetic nerve. And this orbicularis oculi, which is the palpebral part of orbicularis oculi, is supplied by the facial nerve. Okay, So this was about the structure and functional anatomy and arterial and nerve supply. Now we will discuss the inflammatory condition, and now we will understand. Okay, so the first condition is the chalazion. What is chalazion? Chalazion is actually it is the lipogranulomatous inflammatory reaction in the meibomian gland. So when there is the formation of granulomatous inflammation, but the lipogranulomatous inflammation in the meibomian gland, that is called chalazion. Okay. Now pathogenesis. How chalazion form? Chalazion, for example, if anything, infection, injuries, burns, etc. If anything blocks the duct of this meibomian gland, if it blocks this duct of meibomian gland, what will happen? The content of this duct, the oily secretion of the meibomian gland, they will accumulate inside the gland. These secretion will accumulate inside the gland and it will irritate the gland. So in response, the body will initiate an inflammatory reaction. Inflammatory reaction, so the macrophages will come, the macrophages will become epithelioid and joint cells, and they will surround the glands and its secretion. So that's why it is called that these secretions are lipid secretion, okay? And there is the macrophages form epithelioid cell and joint cell. That is why it is called the lipogranulomatous inflammation. So there is the formation of lipogranuloma, and it will then swell up if these secretions are accumulated and there is the initiation of inflammation. What will happen? There will be a visible lump on the eyelid, and this we call chalazion. So this is chalazion, the pathogenesis of chalazion. The sign and symptoms. Chalazion is most commonly occurring on the upper eyelid. Why? Because the meibomian glands are more in the upper eyelid. They are about 30 to 40 in the upper eyelid and 20 to 30 in the lower eyelid. So that's why it is common on the upper eyelid. It is a painless nodule on the upper eyelid or on the lower, but it is a painless nodule. It does not have any tenderness or pain. And if we evert the eyelid, if this is the chalazion, and if we evert the eyelid, the conjunctiva overlying the chalazion will be red or yellowish red. Okay. So these are the signs and symptoms. So the treatment options. So what is the treatment? If chalazion is small, it will resolve spontaneously. It does not require any treatment, but its resolution can be speed up by we will prescribe the patient to apply warm compression and expression compression on the chalazion. So it will speed up its resolution. But the large chalazion require treatment. How? Steroid injections. Steroid injection with, for example, triamcinolone acetinoid. When we inject a steroid injection through the conjunctival surface into this chalazion, its resolution rate is about 80%. So it has a high resolution rate, but they are saying that the most definitive treatment of the chalazion is the surgical drainage of this bump through the chalazion clamp. Okay, so this was about the chalazion. Now the next condition is Hordeolum. What is Hordeolum? Hordeolum is the acute suppurative infectious nodule of the lid margin. Acute suppurative infectious nodule of the lid margin. Okay, it is caused by Staph aureus. Okay, Staphylococcus aureus bacteria is the most common cause of this condition. Staph aureus. Okay, we have two types: Hordeolum externum and Hordeolum internum. Hordeolum externum, it is the acute suppurative infection of this lash follicle and associated gland of Zeus and mole. When there is the acute suppurative infections of this lash follicle and its associated gland of Zeus and mole, it will be called Hordeolum externum. It is also called Stye. Okay, it is also Hordeolum externum is also called Stye. So the clinical features of Hordeolum externum is that as we have discussed in the chalazion, that this is the lump or nodule on the lid margin, but it is painless. The patient will present with pain. In Hordeolum externum or Stye, the patient will present with pain. there will be tenderness, okay. As we know that this is the infection of the lash follicle, so if we epilate or if we remove the lash follicle, what will happen? The pus will come out. The pus will come out if we, by removing the lash follicle or the lash, the pus will come out of this infectious nodule, okay. So this is the Hordeolum externum or Stye. Hordeolum internum is the infectious, it is the acute suppurative infections of the meibomian gland. This is the meibomian gland and it is its infection, okay. So the infection of this gland of Zeiss and mole with its lash, it is called externum, and the infection of the meibomian gland, this is called Hordeolum internum. Hordeolum internum, the clinical presentation is same like the Hordeolum externum, but there are few differences. There will be the tenderness and the pain will be more in the Hordeolum externum. Why? This is because the gland is large and it is occupied and it is present in a tough mass of connective tissue, as we have discussed in the tarsal plate. So that's why it will create more tenderness and pain. And if we evert the eyelid, and there will be the yellow pus will be visible through this ducts of the meibomian gland. And if we massage the gland, this pus can come out. So we can confirm by massaging. If we massage the gland like this, if this is the lid margin, and if I evert the lid margin, and if I massage it, so there will be the pus will come out through the duct of the meibomian gland. So it will confirm that it is the Hordeolum internum. Okay. Now these were the signs and symptoms of both. Basically the signs and symptoms of the Hordeolum externum or internum, they are similar but with few differences. That if we remove the lash follicle, then the pus will come out with the lash follicle, with the lash. And if we massage the gland, and if it is a Hordeolum internum, the pus will come out like this through the opening of the meibomian gland. Okay. The treatment option is antibiotic, as this is the infection, so topical antibiotic. We will give topical antibiotic to control the infection. Systemic antibiotic can also be given if it is severe. Okay. We will prescribe like topical antibiotic like sodium fusidic acid, chloramphenicol, ciprofloxacin, etc. Okay. Steroid can also be recommended. Okay. So these are the treatment options: topical antibiotic, systemic antibiotic, steroids. Analgesic can also be given, because the presenting feature in that these patients will present is pain. So analgesic can be given and can be required in severe cases, obviously. Okay. So this was about the Hordeolum.